Hi, dear students. We have to talk again health effects of air pollution. And in this chapter and in this session, we again trying to talk when the concentration of pollutants increases in atmosphere, how it negatively affects the human health. If there is no contaminant or no pollutant in air, air quality is good, and the people who are living can lead a good and healthy life. If the pollutants of different pollutants are the concentration of different pollutants such as sulfur dioxide, carbon monoxide, ozone, lead, and other gases. These concentrations are particle matters increases in environment, the health of the atmosphere, health of the air reduces. Consequently, the people who are living over there also negatively affecting due to the bad air quality. So here we have to talk the hazardous air pollutant, especially mercury, hazardous air pollutants, especially hydrocarbon H. Elemental hydrocarbon inhaled as a vapor because it can be converted and converted into vapor or it absorbs by lungs. Elemental hydrocarbon are H inhaled as a vapor because when the hydrocarbon is present in environment, it converges into fumes and vapors, and the people who are taking breath are living in that environment. They are inhaling the vapors of hydrocarbon, and these vapors are absorbed by lungs. Vapors of hydrocarbon are absorbed by lungs, and the cause from where it is, because the nature of the hydrocarbon is to be vaporized mercury. It converts into fumes and vapors, and these vapors are going into the lungs through inhalation and nasopharyngeal cavity, and these vapors are absorbed in lungs and causing negative health effects on individuals who are living out there. So what is the source of the mercury? If you will see, the source of mercury is over here, coal combustion, the units where we are burning coal, accidental spills of mercury, mining, and a teeth silver filling. The doctors are using teeth silver filling. These are the main sources of mercury into environment. Effect is what it does when the vapors of mercury are high in atmosphere in air, and someone will take breathe in such environment. So what will happen? We will see here effects. Nervous system will be damaged. If someone will inhale, someone will take breathe in such environment where vapor concentration of hydrocarbon is higher, so nervous system of individuals will can be damaged. It can be acute or high. Respiratory system will be damaged, will cause problems. It, it may be chronic or it can be low. Kidney failure may be, skin problems may be, eye problems, immune system will be damaged, and mutagenic properties are also there. It can cause cancer in individuals who are who will be exposure for longer time with mercury vapor. So what will be the symptoms when someone will be exposed to the mercury vapors? Acute chills, nausea, chest pain maybe, tiredness, cough, gingivitis, and general malaise. And chronic, what can be? In chronic disease, weakness, fatigue, fatigue, weight loss, tremor, behavioral change. So these are some negative impacts of the hydrogyrem, and this is the property of the hydrogyrem that it converts into vapors, and the vapors can survive in atmosphere for longer time, and people will inhale certain vapors, they can be suffer from this disease. And nextly, we are going for the hazardous air pollutants. Dioxins are also air pollutants. These are also generated from human anthropogenic activities, and these are going into the atmosphere, into the air. If someone will inhale from air, these dioxins are going into body and cause poisoning. We will see here generic term for several chemicals that are highly persistent in the environment. And about dioxins, it is clear, and most of the people believing that dioxins are persistent in environment, can live in environment for longer time. And examples you can see from here, examples of the dioxins are chlorinated dibenzopidioxin, CDD, chlorinated dibenzofuran, certain polychlorinated biphenyls, PCBs. These are very dangerous and persistent dioxins and pollutants which are considered recalcitrant and produced by human beings. So another way you can say these are xenobiotics. Costs, these are generated from burning of the hydrocarbons in presence of chlorine or chloride. And what is the source from where these dioxins are coming in the atmosphere? That is waste incinerators. The dumping sites where we are burning the waste material, that helps, that is main source of the release of dioxins from organic material to atmosphere. Notice the chlorine atoms on the benzene ring type molecules. Probably all these type compounds are carcinogen. All dioxins which contain benzene ring and other secondary molecules are attached on surface and different sides of this benzene ring. These most of all these molecules and compounds are considered carcinogenic. So what we can say, does using chlorine to treat drinking water results in the formation of the carcinogenic compounds? So this is question for you guys from this slide. You have to prepare the answer of this question and have to communicate me in written form. These are the examples of the dioxin molecules: 2378 tetrachlorodibenzoin P dioxin, 2378 tetrachlorodibenzofuran, 334455 hexachlorobiphenyl. These are recalcitrant, anthropogenic, and xenobiotic molecules produced by human beings, and these are released into the atmosphere and can survive in atmosphere for longer time if someone will breathe and someone inhale such air. So these are affecting the health of that individual negatively. Hazardous air pollutants, especially dioxins. These pollutants, these dioxins have varying toxicity, Problems with high exposure, exact effect of low exposure not known. When the concentration of these dioxins is very high in atmosphere, so these are affecting health negatively. Health effects carcinogenic, these are causing cancer in such people who are living in such environment where concentrations of dioxin is very high. Some are non-human carcinogens such as this 2378 tetrachlorodibenzoyl TCDD. Other dioxins are reasonably anticipated to the human carcinogens. Reproductive and developmental effect. These are affecting reproductive system and causing negative effects in uh, development of new organisms. So here in this example, you can see this is picture before exposure to dioxins, and this is just after exposure to dioxin high concentration. So this is comparative photo showing Ukraine's vector Yashenko immediately prior to and immediately followed dioxin positive. This is an extreme case of the dioxin poisoning. So we have to take care about our atmosphere, and if the concentration of dioxin is too much in atmosphere, we must have to take care. Here we have to talk other aerosols. These are some gases, some elements, some xenobiotic compounds in atmosphere. Now we are going the main thing of air, bioaerosols. Which type of biological molecules are present in atmosphere? If someone will take breathe, if concentration of the biological molecules such as viruses, bacteria, fungi, fungal spores, allergens, pollens, if the concentration of these organic molecules are living molecules will increase in the environment, and someone will breathe in such an environment, so what will happen? Aerosols with organic origin, aerosols which are generating due to human activities, due to mechanical activities, due to flow of the sewage water and other things, and air movement. So what happens? Aerosols are coming into the environment from organic material that contains a live molecule, that contains a non-viable pollen, tenders, insects, excreta, sea salt. These are non-viable molecules can generate can from aerosols, from organic aerosols. And viable molecules may be microorganisms, especially those microorganisms which have a smaller size, causes aerosolization of the organic material. Whenever we are treating organic material at any place, due to human activities, due to animal activities, due to air movement, this the content of this organic material is going into air. And organic molecules with bacteria, with viruses, with fungi, that molecules are living for longer time in air due to aerosols. And it depends on the frequency of aerosols and the tendency of aerosols and the power of the aerosol. If uh, it is something, some organic molecule has been aerosolized with power, with a high power, it will go up to the upper sides of the environment and will live there for longer time. And individuals who will breathe, who will inhale that air, these organic molecules, bacteria, fungi, and other molecules will go, and cysts will go inside of the human by inhalation, such as bromine, dusting, blowing, These all activities are responsible to raise the aerosols of organic aerosols, which contains molecules, bacteria, and fungi. Sources: human sneezing. Okay, because everyone is sneezing with full power, and due to that, aerosols which are generating from mouth, those are going up to longer distance. Cough, wind, waves, wastewater treatment plants, and cooling towers. These all things are responsible to generate the aerosols of organic origin, which contain bacteria, fungi, viruses, and other things. Health effects: what will happen if someone will take breath in such an environment? So allergies: if pollens are present in air, someone is allergic from those pollens, so allergy will be there, and that can lead to the death in some cases. In severe condition, if pathogenic molecules are there, minimum infectious dose. If someone is TB patient and he is sneezing and coughing in our room, okay, people that aerosolize the TB molecules, the TB bacteria into the atmosphere, and such as we can see the virus of the SARS virus, COVID-19 virus, that is also aerosolized by the patients due to their sneezing and cough that is going in ear for uh, longer time, and any individual will take breathe, will take inhale that air, these molecules, these bacteria, these viruses are going in lungs and depositing over there. So mechanical aeration at wastewater treatment, these are the main source of the organic aerosol production, and these aerosols contain the bacteria, fungi, viruses, many things. If these are living in air for a certain time, these are inhaled by healthy people and causing negative health effects. Allergies: pollen, denders, and fungal spores. These are also present in air. If someone will inhale in such an environment where allergens are present, so allergy will affect to that individual. Airborne transmission of disease: and due to aerosols, when bacteria, fungi, and viruses, COVID-19 or tuberculosis viruses, they are going into the ear due to sneezing, cough, and during talking, and someone will take breath in certain environment. These will go into that individual, healthy individual, by inhalation, and will cause disease such as bird flu, SARS, Legionella, and these will cause pneumonia-like symptoms and pneumonia-like infection. Indoor air quality: we have to maintain for this thing. Indoor air quality, ventilation system should be proper, moist check work protection, recycler air, office buildings, sick building syndrome, and hospitals from where we are taking nosocomial infection. So to protect it, so these the bioaerosols are generating where? In ventilation systems of buildings, moist ductworks, protection recycler air. These are generating from these things. And office buildings, especially when people are living over there, they are sneezing, they are coughing, they are talking. If they have some bacteria, viruses, or fungal spores in their body, in their respiratory system, that goes in air of that building, and any individual, any healthy one will go there, that will be affected from those airborne biological molecules or bioaerosols. And if some healthy one is going in hospital, because hospital there are many patients, they are sneezing, they are coughing, they are talking, they are releasing their pathogens into the environment, and healthy individual when taking breath in that environment, what happens? So that is negatively affecting, that is taking disease from hospital, that is called nosocomial infection. infection. And sometimes these airborne uh, aerosols can be used as a biological warfare, such as anthrax and Ebola viruses. These can be used. If someone will prepare these molecules, these bacteria, these viruses in laboratory and will spread in air of any community, so all people will die over there due to infection of this anthrax and Ebola viruses, so can be used for this biological warfare. So these are the bioaerosols. Due to their lightweight and high density, they are living in environment for longer time, and travel from one place to another place. These may be allergens, these may be fungal spores, these may be bacterial spores. These can contain viral particles on its surface, and someone will inhale these molecules through lungs. It will cause disease. So one another point, other aerosols, medicinal application. These aerosols, if medicinal, purposely applied medicine, if we will use uh, the medicine as an aerosol, and if people will inhale this medicine from aerosol, this will go inside of the lungs. This will go inside of the lungs and will absorb into the blood due to high surface area of the lungs. So we can say take advantage of lungs large surface area of thin membrane of alveolar air sac through which aerosol particles easily pass into the blood. So if you want to use a medicine for community, that everyone inhale this medicine to protect from any certain disease, we will generate it as aerosols in air, just like we are spraying perfume in air that will be inhaled by individuals who are living in that environment, in that society, and it will go inside of the lungs, will be inhaled, uh, and will be absorbed through lungs. And asthma, for asthma we are using inhalers. It is also example of the medicinal application of aerosols, and for diabetics, Pfizer use insulin. You can use these things. So this is up to do. I hope uh, we have talked various air pollutants, the gases which are causing air pollution. We have talked in detail what are their negative impacts on human health, and in someone will take inhale or someone will take breathe in such an environment where pollutants are at higher concentration in atmosphere or in air. Uh, so what, how it negatively impacts the human health, how we can measure the air quality, and which are the cases has been considered poisonous for atmosphere and for air quality. And secondly, standards and concentrations of the different gases our in atmosphere, up to which level these are acceptable and up to which level these are not acceptable and are very dangerous. We have talked in detail. You have to go through any book, uh, especially indoor air quality or air pollutants, air microbiology. You can see this chapter in Plexar. You can see this chapter in uh, what is the name of that book? Okay, environmental microbiology. You can see, and you can read from that book and can discuss. If you have still any question or problem, you must have to ask it to me. Thank you. Have a nice time, please.